The time that you give your chest compressions is after you've determined that your patient is unresponsive, after you've opened the airway, and after you've given your 2 ventilations and assessed for a carotid pulse. Once you know there's no carotid pulse, it's now time to begin CPR. You want to make sure that your patient is on a hard surface. If your patient's on a bed or on a couch, you want to move them to the floor and lie them supine, which means on their back. By doing this, when you're giving your actual chest compressions, what your goal is to actually compress the heart and to make it contract. By doing that, you're using your sternum and your vertebrae in your back to use as braces, which are kind of pushing the heart together. If you don't have them on a hard surface, you'll just be pushing the body down and not actually compressing the chest. Once you have your patient on a flat surface, you want to find your landmark. Your sternum, you can see, kind of starts where your clavicle is, and it ends at what we call the xiphoid process, which is kind of right here in the crease. Once you locate your sternum, you want to find the bottom third, which is usually just slightly below the nipple line. You want to use the heel of your hand or your palm and push that right on that location. You then want to interlace your fingers. You want to keep your elbows straight at all times, keep your back straight, and you want to push down nice and hard. You ideally want to go at least 1/3 of the depth of the patient's chest. It's not uncommon during CPR to actually break ribs. It's not a goal, and you want to try to prevent doing it, but just know that if it does happen, it is fairly common, and it technically does mean you're giving good CPR because you're pushing at the depth needed. You want to do your compressions at a rate of about 100 times a minute, pushing nice and deep. That's a good example of about the rate that you want to give your compressions. It's important that after 30 compressions that you go to give 2 ventilations again. Try to keep that ratio of 30 compressions for every 2 ventilations. After which, that's called 1 cycle. After 2 minutes of those cycles, you want to again assess for responsiveness in your ABCs, including the airway, breathing, and circulation. You do that like we spoke about earlier, opening up the airway, listening and feeling for breathing, and assessing for that carotid pulse.